This is Dr. Hervey. I wanted to come to you today and talk to you a little bit about declining the scheduled C-section for macrosomia. In my practice, again, I've had a lot of moms transfer care late in practice because they walk in the door and suggest their provider or some other entity has suggested that they should have a C-section because their baby's too big. I always remind those families, number one, we don't know what we're going to get until we open the box. Number two, the human bodies are remarkable and can do things that we assume it can't do. Now, I do also state to the patient we shouldn't be dumb. We have data here, and this data says babies are big. And if baby's big, that we should be conscientious about our actions and our movements so that we don't get into trouble. So my story here. One mom came to my practice. She was 38 weeks and 5 days. Scheduled C-section based off of ultrasound findings of macrosomia at 39 weeks. The patient did not want that. Her providers would not bend or adhere to anything else. Again, these are ACOG recommendations, not requirements. So nonetheless, patient came to my office. I expressed to the patient, if we fall off the labor curve, we should transition to C-section quickly to avoid any risk of shoulder dystocia, fetal injury, even fetal death. All these things was explained in detail. Patient said, yes, I just want the opportunity to try. At 39 weeks and 5 days after her scheduled C-section was supposed to occur, the patient called me up and said, hey, I'm going to the hospital. My bag of water broke. I think I'm in labor. I live 5 minutes from the hospital, 2 o'clock in the morning. Patient beat me to the hospital. She walked through the triage doors and said, I think I need to push. They could barely put a stretcher under her, rolled her into the ancillary room, and she delivered before I showed up into the hospital. I was there to help deliver the placenta. My point to this is, again, we just don't know what our bodies can do. We don't know how big the baby is truly. It's an estimation. There's a lot of variables here, but we have to be smart. That patient would have had a C-section at 39 weeks and 0 days. Again, I've had many different stories too, where patients come in who said that they had a diagnosis of CPD, cephalopelvic disproportion. In doing so, mom, 7-pound 4-ounce baby, had a C-section. Next baby she delivered with us, 9 pounds 8 ounces, pushed for 4 minutes, no shoulder dystocia, no other issues. So the question is, what's the difference? I think we failed to also document for these families what else might be occurring in that pregnancy. At the time of C-section, was there nuchal cord? Was the cord short? Was there fibroids? Was baby OP? These are all very valuable clues to tell us what a mom's capability for a VBAC might be, that I think we as providers need to also pay attention. So I encourage the patient, you, to ask those questions if there's a transition to C-section. Maybe it's purely macrosomia. You had an 11-pound baby, 12-pound baby. These things do also occur, and they should not be taken lightly. Again, not telling you to balk against your provider. What I am telling you is ask the questions, right? I'm telling you that a primary C-section based off an ultrasound finding might not be the right next step. Being allowed to labor, allow your cervix to dilate, see what your body can do. But if you fall off the labor curve, then you should transition that C-section quickly and safely for your safety and your baby's safety, 100%.